Okay, hopefully the final footnote thing. Homeopathy, double-blind studies, etc., etc., etc. Okay. From a standpoint of homeopathy, the problem with double-blind studies is that you don't give medicine to the patient. You give some patients no medicine. And for a lot of doctors, that's a violation of the Hippocratic Oath. The first rule of which is, first, do no harm. Well, what's the harm? Well, the harm is giving a pill to somebody that you know isn't going to work. In order to establish this proof through the so-called double-blind study that the medication that's being given to the people that are actually getting the medication works. So basically you're lying to a whole bunch of people in order to get this double-blind study, which seems like it's a good thing to do from the standpoint of, finding a proof that the medicine works. But it's actually not ethical. And so a lot of homeopathists and a lot of anthroposophical doctors and a lot of other physicians don't really like doing that. They don't participate in those things. And in my essay on psychiatric, I'll talk about the hospital which used double-blind studies on schizophrenics, and what happens to schizophrenics is getting the placebo. It's basically torture. You torture this patient in order to get the consequences for your study. And of course the study is demanded by certain ideas in science which says that we have to have a certain degree of proof that's beyond anecdotal evidence. That is, if you give a medicine to a person and the person says, "Oh, I got better, I feel better, my life is better, the medicine helped me," the hyper-rationalists among the scientists will say, "That's not good enough. Your subjective feelings aren't good enough. I need an objective study." And I actually participated in one of these with regard to a blood thinner, an experimental blood thinner. There were 15,000 of us worldwide. And they gave me this experimental blood thinner because I had atrial fibrillation. That is, my heart, and like 12% of the population has this. They have an irregular heartbeat. And what happens when your heart doesn't beat right, it kind of pauses more often than it should. You can have a process with the blood sort of sitting in the heart for a moment, and because it's not in movement, it starts to coagulate, which is an interesting thing to think about anyway, that the coagulation process needs for movement to stop. Okay? But anyway, so they give you the blood thinner because they don't want your irregular heartbeat to cause clots, which then can go into the brain and cause strokes, or into the arteries in the heart muscle and cause heart attacks. Okay? So I'm on this study medication, and of course I have my heart attacks when I'm on the study medication. I have the heart attacks after the doctors do a stress test. That is, they make me stress my heart, which some people think dislodged the actual plaque that eventually blocked the, okay? Now, I'm not doing a screed against doctors, okay? I'm just saying they don't know everything. And in fact, when I worked with nurses in the hospital, one of them used to say, "MD does not mean major deity," even though a lot of doctors, you just watch them abuse nurses because they think they know stuff. And they should be confident. They should believe what they think they know. But they can go to excess just like anybody goes to excess. And one of the things they think they know is that homeopathy can't work. So they won't pay attention to anecdotal evidence, that is, people saying out of their subjectivity, "I got better," And they won't pay attention to doctors who are homeopathists or anthroposophical doctors who say, well, my patients get better when I give them these diluted medicines. And then they want a double-blind study, and then the double-blind study doesn't seem to give them what they want. Well, what do they say when they do the double-blind study? Well, they say things like, I don't know, I haven't read any of these things in a while. Anyway, I just want you to make you aware of the argument. And I want to suggest to you that once we get into the spiritual understanding of the relationship between spirit and matter, even in terms of medications, you'll understand why Tom Cowan, in some instances with his therapeutics, that is, where he's helping to heal the life force's body, will use homeopathic medicines and supplements and other kinds of things in order to renew the life force's element of his patients. And the thing to understand is this is done because it works. And he's not about, and other doctors of the same quality are not about to go out and indulge themselves with double-blind studies where you have to hurt part of the population you're testing in order to get what you think is evidence that's going to tell you something that maybe you should be able to get just through your own observation. Did you help the patient? Did the patient say they've been helped? This idea to turn medicine into a science like physics doesn't really work, because medicine is an art. Diagnosis is an art. Treatment is an art. The doctor is way more subjective in what he does than they like to admit. They like to think that they're doing physics, but they're not doing physics. They're practicing art. And it gets even worse if you get into psychology and psychiatry. The soul healer is an artist. Okay? Anyway, welcome to the adventures of managing your own health. Try to stay away from big political issues about it, although you can get caught up in it, because the pharmaceutical companies want to get rid of anything that doesn't make a profit for them, which puts them way against supplements and all the other kinds of things that are going on in the world that ordinary people are finding helps them, And they can say, well, you can't prove that it works. In our double-blind studies where we have to harm half the people in the study. What they're really saying is, if I use a sledgehammer with all these side effects, we can prove that works. Aren't you glad? When I was taking this study drug that I was on, I got an increased number of emotional problems, and nowhere in the questionnaire did they ask me about changes in my psychology. They weren't interested. They wanted to know, did I have unusual bleeding? Did my nose bleed? Or did cuts coagulate or not? How long did it, I have problems? They didn't care that I was going through all these emotional ups and downs that eventually caused me to get into fights with my partner, and we broke up. All the while I was taking this medicine with its wonderful side effects. Get into what's happening to our soldiers that are coming home. Be wise, be thoughtful, learn.